My today's topic is all about lactation. So I welcome everybody here. Thank you for joining the session. Thank you, Dr. Vedey, for the introduction. So let's start with the topic. So before going ahead, I would like to first just discuss that why is it actually necessary to talk about this during the period of pregnancy. There are several reasons, so we are going to discuss that first instead of going ahead about to learn about breastfeeding. So first is that the preparation for breastfeeding is very, very important during the period of pregnancy. Why? Because definitely it will make you confident. If you're aware of things, how things will go ahead after you give birth, how you can start feeding your baby, how your family can support you, how your the husband can support you. So it will give you that confidence that that will in a way increase the chances that you're breastfeeding your baby very nicely. So how can you do that? First is definitely get good prenatal care, so that if you are taking all your multivitamins, all exercises, food, everything, you're meeting your doctor, everything is going fine, there is no chances of any high risk pregnancy or early delivery or early birth, then definitely your breastfeeding will be a positive outcome. Now, the second thing is that share with your caregiver that you would like to start breastfeeding as early as possible after giving birth, so that she is also aware of what exactly you need after giving birth, and she will keep that in mind. Take a breastfeeding class, you'll get to know the reason why. Then ask your caregiver to suggest you a lactation consultant, so that you can, maybe meet her once, talk to her once before you give birth, tell her about your needs and wants. What do you want exactly to happen after you give birth? You want to feed the baby as early as possible, you want to give skin to skin contact, etc., etc. Then talk to your friends or relatives who have breastfed. Reason being that you might be then aware of what are the challenges they are facing, what are the positive aspects. Considering if they faced any issues, you can also think about it earlier. If you're aware of, you can also always take a step beforehand, right? So let's go ahead. So breastfeeding is a natural act. It is also a learned behavior. An extensive body of research has demonstrated that mothers and other caregivers require active support for establishing and sustaining appropriate breastfeeding practices. We are there to help all the mothers. It's just that they require support for initial 15-20 days or maximum month, and then both the mother and the baby are equally confident, and they can continue breastfeeding for 6 months and even for a later period. So why breastfeeding is natural? How it is? So I will just give you a simple example. You can just see it from the images, right? So we are kids as babies, all the animals, they also have babies, right? They give birth. We are not teaching them how to feed their babies. It is very natural. They do it. Milk comes. It is everything natural. So it is something which is happening inside a mother's body. It is something which you can the baby is also aware of. The babies are born with inborn reflexes of how to take the feed from a mother's breast. So there's nothing to teach. It's just that initially they require support and counseling so that they are aware of the process. That's it. Now, first, we will discuss benefits of breastfeeding, so that you're aware of the importance, you are aware of the positive aspects. So benefits, we have different for the baby and different on part of the mother. So let's discuss for the baby first. So if a baby is exclusively breastfed, so exclusively breastfed means that we are feeding the baby only with breast milk for the first 6 months without anything, no formula feed, no water, nothing else. That is known as exclusive breastfeeding. So it has various benefits, like children who are breastfed for 6 months are less likely to become obese. It reduces the risk of sudden infant death syndrome. It decreases the risk of childhood leukemia, asthma, allergies, various respiratory problems. Then it contains antibodies, which is very, very important, that help your baby fight off viruses and bacteria. And of course, if there is no risk of infection, if the immunity is very strong, there will be fewer hospitalizations, right? Then if the immunity is high, infection rate is low. So no, ear infections, diarrhea, stomach problems won't be there, no frequent visits to the doctor. So all these things are, we throw them away, basically. There is a very less probability if we are feeding the baby. Now, on part of the mother, there are again various benefits for the mother. First, it helps in burning extra calories, so it can help you lose some of your pregnancy weight actually. It releases an hormone oxytocin, which helps your uterus return to its pre-pregnancy size and may reduce uterine bleeding after birth. So what happens when we start feeding, when we start helping a mother to breastfeed the baby, or you initially for day 1, day 2, some mothers have very strong contractions. It's like cramps. उनको लगता है कि हमें stitches में pain हो रहा है या lower abdomen में pain हो रहा है. So, but it is because that the uterus tends to contract while you are feeding. It is because this hormone oxytocin is being released in the body while you are feeding your baby. So, and ultimately the uterus has to come to its original size. So the process becomes just a little faster when you feed your baby. Next, it reduces the extra bleeding also that happens after birth. It also lowers the risk of breast and ovarian cancer and osteoporosis for the mother. And families who follow optimal breastfeeding practices can, of course, save a lot of amount in their expenditure, because it costs a lot if you are giving formula feeds to the baby. So what is right for you and your baby? Apart from other benefits, so we are not going to go too much in detail of, the nutritional quality, but if we see human milk, animal milk, and a formula milk, best is human milk. Why? Because right amount of protein, fats, iron, everything is there. Water is itself in there. We don't have to, like, if we are preparing a formula, we have to add in water for a proper dilution. If you're adding more water, the dilution will be wrong. If it is less, it will be too thick. Again, the dilution is wrong, right? Then itself, in that, anti-infective properties and growth factors are already present for the baby. So it is apt for the baby. Everything is in correct amount. The quality of the milk changes automatically. It happens naturally as the baby's grows with age. The quantity and quality changes on its own, right? So it is tailor-made for the baby basically. While if you are giving animal milk or a formula milk, the first important thing is that it takes longer time to digest, because animal milk is for animals. It is not for humans, right? So animal milk, the intestine, the stomach, everything is different for them. For us, it is different. So how is it possible that that a small human baby is digesting that animal milk, which is only meant for animal babies, right? So of course, you can see what is right here. Now, advantages of breast milk on its own. So nutritionally adequate, we just saw that. Why? It is easily digestible again. It is ready to serve. So anytime, whenever the baby is asking for a feed, a mother can feed the baby. Nothing is to be done. No extra work is to be done. Protects against infection, because the initial milk that comes, for example, especially the colostrum, it is very high in immunity, right? So very important for the baby, which protects the baby against infections. It protects against adult onset disease, free from any contamination, because there is no risk of, sterilizing anything. You just have to place the baby on your breast. Nothing is there. Okay. So zero cost, no money is to be spent. So these are all the advantages of breast milk. Now we will know a little bit more about breast milk. So as I told you, the quality changes and the quantity also changes. So what happens when a mother gives birth? Right after giving birth, when we start feeding the baby, the first milk that comes is colostrum. It is very less in quantity, hardly comes in few drops, but very important. Why? Because as I told you, it is very high in immunity. Thick yellow milk. So a lot of, I've seen personally, people are squeezing their breasts to check अरे मैम आ रहा है कि नहीं आ रहा है, डॉक्टर्स आर कमिंग, आ रहा है कि नहीं आ रहा है. These questions are not required. We are not supposed to check on the very first day whether it is coming or not. Milk is there. It is a natural process. When we place the baby on the mother's breast, the baby suckles. It is not giving pain to the mother, right? So the responsibility of suckling is, the baby already has that. We are not supposed to do that. Okay. So it is very less in quantity that comes for 2-3 days. After that, what happens? Transitional milk starts coming. So when a mother is feeding the baby continuously, right, within the specified gaps, we'll come to that later. So the quality and the quantity changes. So it will become slightly transparent, and then it will slightly become whitish in color. Quality wise, this will change. Quantity wise, it will increase. Plus, it will become a little bit thin. Last is the mature milk. It starts coming after around 10 to 15 days. The mother will be at home, but most probably comfortable with the feeding during that time. So in that milk, what happens? So your body will be aware for how long my baby is taking my feed. Suppose it is for 20 minutes. Suppose it is for 30 minutes. For initially 10 minutes, if it is 20 minutes, initially for 10 to 12 minutes, what will happen? Fore milk will come. Fore milk is basically rich in water. And then as the baby is taking the feed continuously, after fore milk, in the last few minutes, hind milk will start coming. What is that? It is a fat-rich milk. Now, I specifically, counsel mothers every day, even on the day of discharge, to feed from one side at a time. Very important. Why? Because if you are feeding of from 10 minutes ma'am idhar se kiya, 10 minute idhar se kiya, what will happen? You are giving fore milk every time to the baby. Later the baby is not getting the hind milk, which is rich in fat, which is responsible for the weight gain of the baby. And this is being happening for like a month and or more. You are visiting your pediatrician and the baby's weight is stagnant. Why? Because you are not feeding the baby properly. So you will get to know the result afterwards. So this is very important to not to switch sides in between the feed. Now we will just see the photograph wise. So you can see colostrum, it is very less in quantity. We can see it is slightly thick, yellow in color. Transitional milk, it becomes slightly transparent than that yellow color, more thinner, quantity is increased. And then later is the mature milk, fore milk and hind milk. So fore milk is a watery milk that we can see, and hind milk is slightly yellow in color, the fat rich milk that comes in, right? So this was about breast milk. So the quantity and quality will naturally change. Mother has, she's not doing anything to change the quality. It's just that she has to feed the baby every time and it will change. That's it. So before going ahead with, how the process happens, it is important for you to know the breast anatomy. I'm not going into detail. It's just two simple things, that it is breastfeeding. It is not nipple feeding. Okay. So you can see why we don't say nipple feeding, because many mothers, they are just, forcefully at times placing, their nipple into the baby's mouth. Acha, doodh le le, doodh le le. It is not nipple feeding. For a breastfeed, what I want to say is that the baby's mouth should be wide open, holding the mother's breast properly, because the ducts are, the black portion that you can see is the areola. And there in between, you can see that the milk is being collected. So the milk is not being collected inside the nipple. It is in the areola portion. The ducts are ending up there. Okay. So the baby has to hold the mother's breast properly, so that you are doing, you are focusing on appropriate breastfeeding. Nipple is just a medium for the milk to come out for a proper flow. That's it. So this is a process. We will not go into detail of, what happens with the reflexes in the mother's body. It's just that two hormones are responsible for breastfeeding. Nothing related to outside. Okay. On the very first day, we, get to see that they are taking jeera, ajwain, til seeds. Are khana khayegi to doodh aayega, pani piyegi to doodh aayega, nahayegi to doodh aayega. No, all these things are secondary. I'm not saying that they are wrong. कि आप खाना नहीं कि खाना खाना चाहिए, तिल is important, jaggery is important, jeera ajwain is important, definitely, but do not depend on them. Important is what? Important is that you're feeding the baby directly. That's it. So why? Because it is all internal. Two hormones are being released in your body when you start breastfeeding. One is prolactin. So when the baby starts suckling, right, on the mother's breast, what will happen? Your reflexes will start working in the brain. One hormone is first is prolactin. It will help in production of breast milk. Okay. And then the second hormone is the oxytocin. It's a love hormone. So that's why when you're feeding, you should be only focusing on the baby. No screen, no conversation, no gossips, nothing, nothing. Just relax yourself. The more you relax, better will be the output. Okay. So only two hormones. The baby starts suckling, prolactin helps in the production of breast milk. Then oxytocin is also being released. It is helping the milk to flow out of your breast while the baby is suckling. That's it. So it's all an internal process that is happening for a proper breastfeed to happen, for the milk to start coming. Now, suppose the baby is a nursery. Suppose there are some family issues. The mother is not happy. The mother is suffering from pain or anxiety or any negative emotion. What will happen? The production of oxytocin will go down. Okay. If the production of oxytocin goes down, what will happen? The milk will not come out. So I've seen this practically, right? So if there are any of the negative emotions, these are the hindering reflexes, in breastfeeding. So if a mother is having, worried about something, she is in extreme pain, doubt, self-doubt, basically, in depression, in stress, even if the milk is there, it will not come out. The breast is becoming hard, but it does not come out. So first and foremost, what is required? She has to be relaxed. Then all the reflexes that will help the milk to flow. For example, she should feel good about it. She should just focus on the baby, right? Then the close, if the mother and baby are too close, definitely that the release of oxytocin will be more. Okay, so that will help in a proper breastfeeding to happen. So there are certain feeding reflexes in the baby also. So many of people they think कि बच्चे को आता नहीं है करना, टाइम लगेगा सीखने में. ऐसा नहीं होता है. They have inborn reflexes. They are born with that. It's just that we have to position them in such a way that they are able to suckle. For example, first the mother's skill helps the baby to position the baby, and the baby learns to take the breast because of the smell. Once we place the baby crawling happens, and then they look up, crawl through the breast and starts feeding. Then first is the rooting reflex. When something touches on the lips, baby opens the mouth and puts tongue down and forward. So how I stimulate, how do we check that the baby is hungry? How before latching the baby, I, put my finger on their upper lip and move like this. What will happen? They will open their mouth and they will try to suckle. This is the rooting reflex. Second is the sucking reflex. When something touches the palate. So the nipple helps in that. When a baby is latching onto a mother's breast properly, the nipple is touching the palate on the upper portion of the mouth. And then the tongue naturally moves. The swallowing reflex also happens after that. Okay, and then they suckle and swallow. And last is the gag reflex. When something touches the anterior part of the tongue, baby pushes it out. So they are born with these 4 reflexes. It's not that they have to learn how to suckle. They already know that. It's just that we have to place them properly. So, sorry. So 99% of the problems that happen, it is just because that the mother is not able to latch the baby properly on her breast. Simple. 99% of the problem only through this one reason. So planning to breastfeed, but how do we know that the baby is hungry? Very, very important, because the first and foremost thing that I observe is जब रोएगा तभी पिलाएंगे. मतलब अगर हम रोते हैं हम तब खाना तो नहीं खाते. So why are we doing that with the newborn, right? So we need to see for the cues. What cues are the baby, is my baby giving you? So it has levels. So first is early cues that the baby is telling you, हाँ मुझे भूख लग रही है, please खिला दो. तो इसमें हम बच्चे क्या कर सकते हैं? They are just doing some like small normal body movements, हाथ वाथ हिलाना, मुंह खोलना, turning head, seeking or rooting. So what is rooting? Again, I told you that they are opening their mouth again and again. So zara sa bhi kuch touch ho raha hoga, so they'll try to open. Otherwise also they'll try to open. If you're not able to understand these early cues, they will give you, I'm really hungry wale cues, mid cues, stretching, increasing physical movement, बहुत ज़्यादा हाथ पैर हिलाना, और finally हाथ खाना, right? If you're not able to understand this also, they will give you late cues. This is when the baby starts crying, very agitated. आप तो समझ ही नहीं पाए, मैं तो अब रोऊंगा, और वो बच्चा बहुत रोता है फिर, and full red हो जाते हैं newborns. So at that time, you don't have to, just take it and place him on over your breast. No, you have to first calm down the baby, soothe the baby, take 2-3 minutes, talk to the baby, relax the baby, and then feed. So better not to wait for the baby to cry. Late cues तक पहुंच नहीं देना है. When the baby is giving you early cues. So suppose anyone is awake, parents are awake, baby is sleeping, you're observing the baby. If you see that, your baby is giving you early signs, start feeding the baby. ठीक है? उसी टाइम आप फीड करना शुरू करोगे तो लेट क्यूज तक पहुंच ही नहीं पाओगे, क्योंकि जब बच्चा ज्यादा रोता है तो एकदम से लेता भी नहीं है, टाइम लगता है सेटल होने में, right? So just try to understand the cues. Don't wait for them to cry, that only if he is crying, then only I will feed him. No. So while feeding, there are many positions that you can follow. Depends in which position you are comfortable with. But the most comfortable position that, I feel as a new parent would be the cross cradle hold, the second position on top that you can see. So this is the best position out of all if it is a single one baby, because in this position you are giving support from your hand. Like I have a doll, I'll just show you. So I'm turning my baby, I think you guys can see, yeah. So I'm turning the baby completely like this, and I can give support to the baby's neck and head properly. Otherwise, if I'm doing a cradle hold, so like this, if I'm doing this, the baby is not aware of how to hold, right? There is no guidance. So cross cradle hold works very much better in the initial, for the initial days. And then after 15-20 days, once the baby is confident, mother is confident, you can feed in any position you want to. However, you can see in the second row, there is a football hold position. So it is for twins. So at times we try that for twins, we are feeding the baby at one time. So at one time, we can just place the baby from sides and you can feed the baby together, so that you are not giving too much of time in feeding first one baby, then second baby. You won't get that much of rest, right? So these are certain feeding positions that you can follow. Proper positioning is very important for a proper feed to happen. So maybe if I talk positioning, it is the position of the mother, it is the position of the baby, and then of course the latch, the way you are feeding the baby. Okay. So first is, if mother's position is definitely that you should be sitting in upright position for a cross cradle hold. For example, if we are talking about that, normal sitting position, keep a pillow at the back, keep a pillow one at the abdomen, place the baby so that the baby is at the level of your breast. Now for the position of the baby, supporting whole of the baby's body. So like I did, I'm supporting whole of the baby's body like this. Ensure that the baby's head, neck, and back are in the same line. So it is in the same line. It is not like this, that the body is straight and I'm just turning the head. It is not like that. Even we can't drink water. So suppose I want to drink water, I will not drink like this. My body is straight. So for the babies also, it has to be straight. Now, entire baby's body should face towards the mother. So it should not be like this. It should be like this. The baby's abdomen touches the mother's abdomen. Simple. This is a proper positioning of the baby, mouth opposite to the nipple. That's it. So if your position is proper, baby's position is proper, the baby will be able to latch properly. Otherwise, what will happen? After every few minutes, the baby will unlatch the breast. तो आपको प्रॉब्लम हो जाएगी उस टाइम पे कि, एंड सबसे पहले आप यही सोचोगे कि मेरा दूध ही नहीं आ रहा है. The first thing that a mother thinks for every problem is my milk is not coming. Okay, there can be other reasons also. So for example, this is a example of positioning, like I just said. So the left one, you can see the pillow is there, one for the back, one for the abdomen. Proper positioning of the baby is also there. She's using a footrest there so that she's not bending down. Her legs are not bending down, right? Now, the image that is not right, where the positioning is not right, we can see that she is just sitting without a support, not holding the baby properly, not using a footrest. With this way, first is the mother is not comfortable. Second, if the mother is not comfortable, baby is naturally not comfortable. If the positioning is wrong, breastfeeding will not be happening properly. Okay, so make sure the positioning is proper. Now, after positioning comes the attachment. Major important thing, like I told you, 99% of the problems in feeding that mothers face is only because of this one thing, the way they are attaching the baby. This is the work that a mother has to do. Baby will suckle after that. So for this, 4 major points you need to see. First is baby's mouth should be wide open, like you can see in the image as well. Chin touches the breast, lower lip is curled outwards, and usually the lower portion of the areola is not visible, nose is free, there's no problem. So these 4 signs you should keep in mind for a proper latch to happen. If a baby is only suckling over the nipple, it will give you pain. It will, you will be uncomfortable. So some mothers say, ma'am, breastfeeding karate time pain hota hai. Why it is paining? Because the baby is suckling over just a tiny little thing. If the baby is latching on to a mother's breast so nicely, it will not give you any pain. So I want to tell you that breastfeeding is not painful. It is something which is very comfortable for both the mother and the baby. It's just that the latch has to be proper. Now, suppose causes of poor attachment. So a baby will not, hold a mother's breast if these things are happening. For example, you just start with one feed through a bottle, the baby will start resisting you. Literally, bachche dhakka marte hain. Those newborns, tiny little newborns, they will just push you away. Why? Because you are giving that one feed in between from the bottle because you are not comfortable. So no bottle feeding. Before you're at least establish your breastfeeding properly. If the mother is inexperienced, so I would say that for a first time mother, it is difficult for the initial days, but she learns. It just takes a little bit of practice, a little bit of motivation, little bit of, awareness. So if she's, she actually wants to feed the baby, she will do that. Functional difficulty. If a baby is of very low birth weight, or maybe a sick baby in nursery. So for example, if a baby is in nursery after birth for like 15-20 days, the baby will take time to, catch hold on the mother. Nipple is not properly erected. So in case of flat nipple or completely inverted nipple, it is very difficult at times for the babies to latch. If the size of the nipple is too big, then also it is a problem. If there is engorgement, so I counsel the mothers in such a way that, before the time when they are facing engorgement, please take a step so that it is not increased. Otherwise, if it is increased, it will affect your feeding and for another 1 or 2 days or maybe more. Then a late start. So if a mother is saying, nahi ma'am, aaj nahi, I want to recover, kal parso se karaungi, you are just delaying the process that way. So please try to feed once the baby is with you. Lack of skill support. Yes, initially you need support for positioning, even for a normal mother who is delivering like vaginally, or even for a cesarean section mother, support is needed initially, but only for few days. Then they both are confident. Now, consequences of poor attachment. So in all these, we just learned about the causes. But if the baby is not attaching properly, if the baby is not holding the breast properly, if the baby is nipple feeding, what will happen? First and foremost, sore nipples, bleeding. So always keep in mind, if there is any pain during your breastfeed, unlatch the baby, latch the baby again. It is just because of one major thing. First thing is that the baby is only suckling over the nipple. Latch is wrong. Only then you will have a biting pain. Next is breast milk. If the attachment is poor, breast milk is not coming out. In a way, what will happen? Your breast will be full of milk. Now what will happen? Engorgement will happen. Engorgement is, extreme heaviness in your breasts, getting hard after that, right? So if the milk is not coming out, it is a problem for both the mother and the baby. For the mother, of course, it will be engorgement. She will be uncomfortable. Okay. Then for the baby, the milk is inside, the baby is not getting milk outside, right? So what will you do? You will end up giving some or the other thing. Baby will be frustrated, refuses to suckle, unsatisfied. All these things will happen. So always make sure that you are keeping in mind the positioning of feed, the way you are latching the baby, and automatically the outcome will be nice, right? So breastfeeding will be proper. Now, how will you get to know that my baby is getting enough of breast milk? Very common question. मैम पता कैसे चलेगा कि कब कराना है, पेट भरा कि नहीं भरा है? सो दे ऑलवेज वांट कि ब्रेस्ट मिल्क दिया है, सुबह से 3 बार दे चुके हैं, अपना फॉर्मूला दे दो. सो पीपल फील कि फॉर्मूला से पेट भरता है बच्चे का, ब्रेस्ट मिल्क से नहीं भरता है. इट्स नॉट दैट. You just have to see the end result of when you're breastfeeding the baby. End result means that the baby should be well rested, not showing hunger signs, right? Even if the baby is not sleeping, the baby is active, but still the baby is talking to you, giving you reactions, not cranky. So this is one part of the baby. And the second thing for the mother is that there is no soreness over the nipples. If you're having a biting pain over the nipples, the latch is wrong. In a way, baby is not getting milk properly. Okay. So these are the initial signs that we see for. And after that, what will you see? Weight gain of the baby. Weight gain is happening properly. Urine output needs to be maintained. So it should be 6 to 8 times in a day after 6 days of birth. And stool is normal. It can happen once a day. It can happen 8 times a day. It can happen once in 2 days, but you need to monitor the urine output, because if there is input, there will be output. So these are certain signs with which, you can observe whether your baby is getting enough of milk or not. So just see the end result. That's it. Don't think how much quantity of breast milk. अरे बच्चे को जितना चाहिए वो उतना ले लेगा. It's just breast milk. So we don't measure the quality or quantity of milk that the baby is taking. We don't need to do that. Okay. So there are certain facts that we are going, myths that we are going to talk about. So just a second. I'm not able to see the first one. Okay, so the first one is, I'm not producing enough of milk for the baby. Then baby needs feed after every 2 hours by the clock. Okay, so let's come for the first one first. I'm not producing enough milk for the baby. How will you get to know that you're not producing enough milk for the baby? You just have to see the end result. If the baby is satisfied after your feed, your milk is enough. That's it. Okay. Baby needs feed after every 2 hours by the clock. No, it's not that. We don't feed the baby by the clock. What we just saw a while back, feed the baby on demand. On demand means on the basis of hunger signs that they are giving you. Plus, if the baby's weight is more than 2.5 kg, it's a healthy baby. So even a 3 to 4 hours gap is okay. So suppose if a baby has not given you any signs, it's been 2 hours, half hours, it is okay. There's no problem. After 3 hours, you wake up the baby and feed. So don't forcefully wake up a normal healthy baby after every 2 hours. It's just, that you are spoiling his sleep and you are getting agitated ki ut nahi raha hai, feed nahi le rahe. Okay. Mothers will it's a typing error. Mothers with a smaller breast will not produce enough milk for the baby. No, it is demand and supply. जितना बच्चे को चाहिए उतना मम्मा produce करेगी. It is all hormonal. It is an internal process. It does not matter whether the breast size is small or big. No, only foods increased breast milk production. No, we just discussed that before. It is normal for breast to hurt while feeding. Of course not. We just discussed that before. So it will never pain. If the latch is proper, it will not give you any pain. It is easier to bottle feed than breastfeeding the baby. You have to do so many things when you're bottle feeding the baby. You have to make sure that you are changing the bottles after every specific period of time. You have to make sure that sterilization is proper. You have to make sure contamination is not there, cost is there, everything is there. So there's a lot of work behind that. Then animal milk or formula milk is good as compared to breast milk. No, referring to the first slide of the nutritional quality that we saw. Feeding should be stopped if you have an infection like fever or in case of a blocked duct. Not at all. In case of a fever. So for example, if a mother is having fever, fever कब हुआ? बाद में हुआ. Body ने response दिया तो fever हुआ. Infection तो पहले लग चुका, हमें नहीं पता. है ना, उस टाइम तो मदर फीड ऑलरेडी करा रही थी, तो जब फीवर लगा तो तब भी तो फीवर कराना चाहिए, बिकॉज ड्यूरिंग दैट टाइम हर बॉडी इज प्रोड्यूसिंग एंटीबॉडीज. सो इफ दोज एंटीबॉडीज द मदर इज ट्रांसफरिंग टू द बेबी, it is just giving strength to the baby's body to fight with infections. So why stopping that ki fever ho gaya? Even the doctors at times, they tell the mothers to stop feeding if they're having fever. It is not to be done. Then in case of a blocked duct means there is a lump in your breast, there is hardness, it should not be there. So like I told you, engorgement अगर बहुत ज़्यादा हो जाता है, फीड अगर ठीक से नहीं हो रहा है, मिल्क आप नहीं निकाल रहे हो, तो lump हो जाता है. You're not supposed to go to that level. Okay, be aware of everything. But in case of a blocked duct, it is always better to feed more and more. Feed more and more. If required, you can also express in between. But feeding is very important, especially the latch has to be in such a way that, the milk is flowing out from the breast. So for a blocked duct, what we can do, we can, first do a warm compression. Warm compression with a towel. Place a hot towel on the breast. It will soothe the breast. If you're having pain, it will soothe. Then the milk that is solidified, it will slightly become in the liquid form. Warm compression will help. After that, do a breast massage. So nothing, you just have to do circular motions with a slight pressure with your own hand. That's it. Especially on the area where you're having a blocked duct. And then third step is feed the baby. Or if you're expressing, express the milk. It will become better in a day or two. Okay, so it is very important that feeding is not to be stopped. If you're stopping it, you are increasing the problem. So don't stop. Then feeding should be done from the breasts at one time, from both the breasts at one time. No, we discussed the reason, because the mature milk will start coming in later. So do not feed from both the breasts at one time, whether it is 15 minutes or it is 20 minutes, feed from one side at a time. How fathers can help, very, very important. Mummy ka kaam thoda kam bhi karna chahiye. So apart from feeding, there are other things which are to be done. And with that, a father can definitely help. Burping the baby. So after every feed, burping has to be done. There are different positions of burp, but as a new parent, for a new parent, it is the most comfortable position that you are keeping the baby like this on your shoulder, head rested well, and you are tapping the back in upward direction. Initially, in 2-3 minutes, burp usually comes. In case it is not coming, just keep the baby in this upright position for 10 minutes and swaddle back, right? So this a father can do. Changing diaper, again, a father can do. Walking the baby, swaying the baby, creating a comfortable environment for the mother at the time of breastfeeding so that she is not disturbed. Because during breastfeeding, suddenly you will feel sleepy. Suddenly you will feel that you are, very thirsty. So he can just help you with other things. Helping the mother in breastfeeding position and latch in case needed. So in the initial time, he can help. Okay, so these are all the things, points where a father can actually help the mother. Then these are some take-home messages. So focus on exclusive breastfeeding. So it means feeding for the first 6 months only with breast milk, feeding the baby on demand as per hunger signs and not by clock. Maximum 4 hours feeding gap is healthy. And then 2 hour feeding up is not for every baby. If the baby's weight is smaller, less than 2.5, for a smaller baby, we make sure, okay, we are not increasing the gap. But for a healthy baby, 3 to 4 hours gap maximum is okay. And the duration of feed will also vary. So sometimes the baby can take the feed for 10 minutes, sometimes 20 minutes, sometimes 30 minutes, sometimes even 5 minutes. It's all okay. All right. Just feed as per the cues. Make sure the baby is relaxed and well rested after the feed. Okay. But maximum duration 30-35 minutes, not more than that. At times, the baby will leave your breast on its own. The baby might sleep. Okay. Sometimes, you are yourself just unlatching the baby because he's suckling very slowly after 20-25 minutes. So that is all okay. Just burp the baby and make the baby sleep. Observe that the baby is relaxed after every feed. KMC and KFC are recommended as and when possible for parents. So what is this? So KMC is kangaroo mother care, KFC is kangaroo father care. What do you mean by that? Just unbutton whatever cloth you are wearing, place the baby over your chest in between, and take a quilt or a stole from above. Make sure the room temperature is normal. Relax the environment, dim the lights, relax. This is a direct skin to skin contact with the baby. Even for the baby, remove the clothes from the front. Okay, if father can do the same. The more you give the touch to the babies with the mother, definitely the oxytocin production will be more milk, more satisfaction. Okay, your breastfeeding will be good, it will be healthier, you both will feel good, baby will also feel protected. And with the father, not with feeding but in other ways, he can support the baby by giving kangaroo father care. So it's just a small thought. Given a choice, each and every baby prefers breast milk because that is what is the healthiest. So these days, many mothers do buy bottles and pumps and supplements even before they give birth. Not needed, not at all needed. It's just that you should be aware of how process of breastfeeding happens, how you can, start with that later. So more awareness is needed, and I think that should help you. So lastly, just to complete the presentation, it is never painful. Okay, so just enjoy the process. It should be comfortable. You can do it anywhere. No need to be shy on that.